Hades. It was terrible. They would cut the nerves in her spine to get rid of pain. They had chemotherapy drips that were directly on the pancreas and the liver to try to get her to survive. She survived another 18 months, which was really phenomenal. But he's forever in debt, and it's just sad. I watched an aunt go through that, and it was unreal how quickly her body was gone. It was just emaciated. But you know, scare tactics never work, because you try to scare somebody with diabetes into stop eating sugar and it doesn't work. They still say, well, you know, oh yeah, another donut. Oh yeah, another piece of cake. They just eat it. So that never works. So, but I still want you to be aware, because information and knowledge is power. Okay?
So does having diabetes can it lead to pancreatic cancer?
Potentially. Usually they don't directly correlate that, but the bleeding gums, yes. Okay? So the interesting thing, again, as you look at the different things that we've talked about in the past, when you look at the anatomy of the liver, the gallbladder, the common bile duct, and the pancreatic duct that goes back to the pancreas on that side, and where they drop into the second part of the duodenum, we've looked at that anatomy before. In essence, looking at those pathways, everything coming to the second part of the small intestine is where the most common biopsy is for celiac disease and those wheat sensitivities. And we've talked about those as well. Very high likelihood for diabetes and hypoglycemia with wheat sensitivities, because those antibodies go back upstream or coming downstream, whichever way they're coming through the blood, have a tendency to start to attack and sclerose or harden those ducts. Okay? So this is what we're seeing though during the day. Our body is trying to constantly keep us between this range. Okay? During the nighttime, our adrenals are the big responsible organ for maintaining our cortisol levels to maintain our blood sugar during the night. So that when we awaken and we're actually measuring this fasting blood sugar, those should be in an optimal range, and the adrenals should be robust enough that they can handle a 12-hour fast without us dipping. Okay? So what's a good sign of hypoglycemia? Waking up feeling very lethargic. I don't feel excited and ready to start the day. I feel like I crave sugar. Where is that piece of candy? Remember Mom's little hiding spot of her chocolates and her little special drawer of the candies and her little purse of goodies that are not for the kids. Those are not treat kids, or kids treats, excuse me. Those are mom treats, right? And that's hypoglycemia. I feel irritable if I miss a meal. I feel like my meal isn't complete without dessert. I feel a little bit of a headache in the morning when I awaken. Low blood sugar. Okay? And all of that again is the hypoglycemic presentation. Question here, then question here. Please?
Well, I heard this comment once, this cute little lady here. Deanna, you know Sister John's? It was in our
Oh, yes.
And I asked, she's a dietitian, and I said, what is the most, somebody asked this question, I heard, what is the most important function of the body? She paused for a minute, she said, well, I might surprise you, but it is to regulate blood sugar, because that causes havoc all of a sudden in the system. I mean, I was blown away.
Yeah.
But she didn't say breathe or your heart beating or, you know, what's the most important function? So really just blood sugar balance.
Yeah.
How important it is.
So the statement there, the comment is, one person commented before that the most important system to regulate in the body is blood sugar regulation. And it absolutely is. You know people who are diabetic that suffer from unhealed wounds, okay, in their feet that leads to the amputations. You look at the inflammation that they have, the arthritis and the joint pains. You look at the neuropathies, the painful feet and the nerve pains, the loss of vision. It's just systemic. Same thing though with hypoglycemia. You have to realize that your body is telling you something when you have these different cravings, when you have these different appetites. An appetite for sleep is an appetite. I need some sleep. Really? Well, I'm not going to give you permission for sleep. Give me that caffeine. Right? And so that's what we do. And
so what organ controls that? The pancreas?
pancreas,
Which organ controls
the blood sugar,
all of these organs? So the question is, which organ controls blood sugar? All. All of these organs control blood sugar.
Okay, so my question was, what does the thyroid have to do with it?
Everything. The thyroid, when you look at thyroid output activates the cells to be able to burn the sugar. If the sugar can't be burned, then you'll have a hypoglycemic presentation. You'll feel hypoglycemic. You'll feel lethargic. So it has everything to do with that. Remember, hypothyroidism, some of the symptoms of hypothyroid are feeling lethargic, feeling slow, dry skin, slow or mental sluggishness. Okay? Those are all thyroid symptoms that are all hypoglycemic symptoms as well. Okay? Good question. Any other questions before we continue?
Is that what they use Synthroid for or something like that?
So the question is Synthroid used for treating hypothyroidism? Yes, medically. From a functional endocrinology perspective, no. We want to look at what's causing the low thyroid first. Okay? So anytime that we look at a low thyroid, the first thing we want to do is see is it an autoimmune thyroid, because most of the time it is. Okay? Meaning your body's actually attacking, creating antibodies against your own thyroid. So before we recommend a medication, we want to make sure that the thyroid's being treated correctly. Okay? So great question.
With your diet? Is that what you mean?
No. So the follow-up question is it diet only that we treat the thyroid? No, we have to treat one side of the immune system or the other. So remember when we did the presentation on thyroid, we're looking at one side of the immune system is the Marines. They love hand-to-hand combat. The other side is the Army. They use chemical warfare. The Marines are T helper 1 dominants, which are the natural killer cells. They go out and engage, and the macrophages eat and identify and consume, and then present to the Army the T helper 2 immune system, which then releases chemicals and antibodies. They have the long-term memory, or the plasma memory antibody response. Okay? So we have to look at which side is dominant and treat that side, or both. Maybe they're both weak, or maybe they're both overactive and suppress them. So you use different supplements for that to be able to resensitize the immune system. Okay? So good question. Any other question before we leave this, please?
Might sound kind of weird. But how is it that I can eat a full meal and then crave sugar right after it?
Yes.
Is that kind of the same thing?
Yes, so this is what we're talking about. So the question is, I have a symptom of, I eat a meal, but it's just not satisfying. So I have to eat sugar to actually feel like, woohoo, finally, full, okay? And that's actually a concept that we call, let me actually describe this, because that's an important concept related to hypoglycemia. When our hunger centers kick in the brain, our body says, find food. So we go out and we find the food, we eat the food, and then what should happen is the body starts to digest through, actually, as soon as you eat food, this is the unique thing about, let me erase all of this. The unique thing about the 3 types of fuel, when you pull up to the gas station, there's several different grades of gasoline, right? Meaning each one has a certain octane content. When you eat food, there's a differing or a variable rate of efficiency that food offers. Okay? Sugars, proteins, and fats. The highest form of storage of energy is fats. Okay?